Welcome to Healthcare IT Today. I'm John Lynn, together with my colleague and friend, Colin Hung. The world of technology and healthcare are ever-changing in new and novel ways, and that's why we love this stuff. So join us as we discuss the latest healthcare and health IT news, meshed together in new ways, which help generate ideas and new perspectives. Plus, we'll have a little fun along the way. Today, we'll be discussing the recent changes with the HIMSS Conference and other hot news headlines. And be sure to follow the show on social media at the hashtag HITSM and our personal accounts at TechGuy and at Colin_Hung. Plus, check out our 17 years of health IT blog content at healthcareittoday.com. A lot of news for a summer, which, summer news doesn't happen that much.
No, normally this is like a quiet time for the industry, but yeah, this year we've got some pretty major news happening right out of the gate, in the summer, which is odd to see.
Yeah, kind of fun for us though.
It is. It allows us to have a really fun podcast episode.
That's true.
Well, first of all, biggest headline, I think it's I don't know if it was surprising or not surprising, but certainly a big shakeup. And that, of course, what I'm talking about is the news that HIMSS has sold off their conference to Informa, which is a company that specializes in running large industry conferences. So, John, what's your take on this news?
Well, Informa's trying to eat the world of conferences. They acquired Targus, which was another private equity backed organization that acquired a bunch of conferences. So Informa's, kind of become a big organization. They have the HCP conference, they have Healthcare Dive, they have Bio World, they have Arab Health, they have, a lot of healthcare conferences. So in that regard, it makes sense why Informa would want HIMSS in their, in their organization and as part of their conferences. So that's not a surprise. And HIMSS, is, I think has been suffering from the COVID debacle that was, canceling the conference 2 days before everyone was flying out. And so, HIMSS had kind of been reeling, and I think had been kind of wondering what is their future and what is, what do they want to focus on? So it's not a huge surprise that HIMSS is looking at changes and what do they want to do. What's interesting for me is that they've sold the conference, but HIMSS is still going to be very involved. So Informa is going to do a lot of the organization, probably will use its, power of how many conferences to be able to negotiate good prices with different venues and things like that, which I think is a powerful thing, because HIMSS probably lost all that negotiating power going from a 40,000, 50,000 person conference to, 18 maybe after COVID, and now trying to get back to 30 to 40 is, according to their numbers, I think they say about 40. Anyway, I think that's where you look at it and say, okay, well, yeah, it makes sense to sell that off. And, one thing that people haven't understood is they haven't sold off their smaller conferences, which are run by HIMSS Media largely. And HIMSS Media is not being sold. So Healthcare IT News and Moby Health News and all that, they're not being sold. So, what does the future look like for them? That's an interesting question as well.
Yeah, certainly. I think we for those, of us that were at this year's conference, I think we all got the sense that something needed to change. I got to be honest, I didn't think it would be something this big.
They couldn't afford carpet,
Yeah,
that's the running joke.
I just, you could almost feel it in the air just talking to people. It's like, hey, something needs to be different. We've run this formula back many, many times now. The conference was a lot smaller, and I don't think it was related to COVID, right? It was just that people weren't finding value. So you just kind of got the sense that it needed to be different. This is very different, right? Like selling to a company that specializes in these large conferences is a pretty bold move. I got to give credit to HIMSS. It's pretty bold to do this. And you're right. What was interesting was what wasn't going with them. Like, it was just the conference. It wasn't HIMSS Media. It wasn't some of these other pieces. So HIMSS itself is, in my opinion, it looks like they've gotten out of the large conference business. And maybe perhaps that was a recognition of the fact that it was occupying so much of their time and yet wasn't generating revenue or, frankly, being that helpful to their members anymore. And so why have this giant event that takes up all of your staff's time for basically a whole year to plan it when the value was declining, at least in terms of the feedback they were probably getting from their members. And instead, I think, what'll be interesting to see is how much focus they now put on their advocacy, right? Their reporting, the analytics, right? And HIMSS media. I'm kind of interested to see how that will pan out over the next 12 to 24 months.
Yeah, I'm not even sure that the conference was declining quite as much as what you just described. I think a lot of vendors were still getting a lot of value. There was certainly many that were questioning it and weren't sure, and there was still a lot of scars from the cancellation that some trauma that people were dealing with. So I think there was that, but for me, I think to your point, it needed some fresh eyes, it needed some fresh organization to be able to compete with the Vive and Healths of the world that are going over the top with their production and all of these things, right? And HIMSS had made some efforts. We talked about that on previous episodes that, like they tried to do some different things, having the dog park and having the, the 360 camera and a few things like that, right? To kind of freshen it up a bit. But it really needed a fresh, start where HIMSS could say, well, that's Informa, right? And Informa could say, we can try some different things because we're not HIMSS. The number one request I've seen from people is, oh, does that mean that the speaker submission is going to become easier? And it will be interesting to see, does Informa hear that from all these people and say, oh, maybe we'll have a more streamlined approach, because it is an intense process that HIMSS puts you through. And so, I'm interested to see how that plays out. But I think it's interesting, and it will be, like, as I understand it, HIMSS members will still get a HIMSS member price to the HIMSS conference. Informa said they're not going to change the name from the HIMSS conference. We'll see if that's true 2 years from now, 3 years from now, but at least for now, they said, why would we get rid of the brand? We're keeping it, right? HIMSS members will probably still get some exhibitor benefits, right? In how they select. So you look at it and you're like, well, is that any different? Right? Like, what is different? And I think what is different is, probably HIMSS gets some more cash to do what you just described, which is, can I beef up our advocacy? Can I beef up our education, our certifications, things like that, and be more of an association in that regard?
Yeah, it's a good point you bring up, and I probably should have qualified what I said before, but I think you're right in the sense that there is still value in the HIMSS conference, right?
Mm-hmm.
And to me, what this news signifies is that the value that HIMSS sees out of the conference is not the exhibit hall, right? It is the stuff around it. It's the speaking, it's the engagement, it's the new networking, it's all those kinds of things that happen around the exhibit hall versus the exhibit hall itself, because I think that's where Informa can bring more of their expertise, right? Is how to run a show like that, and how to maybe get it back a little bit more to being a show where there is actual sales being generated, as opposed to partnerships and those kinds of things. Because let's be honest, right? Like we've heard for years that HIMSS was not the place that to land new business. Right. It was more a place to further business that was already in your pipeline. It was maybe to network. It was much more about business development. Yeah, exactly. So, just looking at other Informa based conferences, they really put an emphasis on lead generation, which I think is a good thing. I think it'd be great for that to return to a HIMSS conference, because then I think people will get even more value from it, or maybe back in the meeting for these days, they'll get some value like that.
Yeah, and I think Informa will bring a fresh perspective, because this is just my feeling, is that many of the people at HIMSS, which ironically a lot of them left, so I don't know how this even plays out for some of the current regime, but it was like they kind of took for granted what they had, I think, because it was the boat show that everyone went to and there wasn't anything else. And then something else came along and they're like, oh crap, now what do we do? And so, when you're the market leader, you can take it for granted and not try some things, like you said, to drive new people that need to be there. But I'm sure Informa is going to focus on that, right? And driving the right people to the event.
Yeah, and we put a lot of focus on health and Vive, of course, but there's also shows like CES, right, that has a bigger and growing healthcare segment.
Yeah, South by
South by
Southwest.
Southwest, yeah, like there's not just other industry events; it's like just general consumer level events that have gotten more and more into healthcare.
Not to
Well,
mention user conferences, right? Like, I mean,
exactly.
think about the Epic, Cerner, every EHR vendor has a user conference, even other ones. I just saw an Interlace conference, Waystar's doing a user conference. Like, everyone seems to be doing it. So, that's a competitor as well.
So John, what do you think we're going to see, or what changes do you think we're going to see or not see at HIMSS 24?
So I actually think HIMSS 24 is going to be business as usual. Like, I don't think we're going to see many changes. It's going to probably be the hymns that we've known for a while. Maybe a few things dolled up here or there. Maybe we'll have carpet, but like I don't think I just think Informa doesn't have enough time before HIMSS 24 to affect massive changes. So I actually think HIMSS 25 is where we're going to see the bigger changes. And I think that, to me, the question is going to be, how does HIMSS perform as part of this agreement? Because I assure you that, you talked about HIMSS seeing the value of the conference or not seeing the value, and where is it growing? I'll tell you, Informa sees it. Informa sees that they could double it, right? Like, they could grow it and they could grow the revenue. Otherwise, they wouldn't be doing this investment, because Informa is not doing this as a charity. It's not a nonprofit. It's private equity that says, I want to take this and I want to double its growth. And what could I do to do that? Right. And so, that's where I think it's going to be interesting, but it probably won't happen until HIMSS 25.
Yeah, I agree with you. From an attendee and frankly from an exhibitor standpoint, I don't think there's going to be a ton of changes by 2024.
Yeah, they're
It's
already
just
paid, right?
they're already
The
paid.
exhibitors, like,
The layout is what it is, right? No one's suddenly going to get a bonus of an extra 10 by 10, right? Or anything like that. Like that's not going to be happening in 2024. I do expect to see a lot more push from Informa people at HIMSS. Like I think
oh,
there's
that
going
would
to
be
be like
interesting.
a full court press of like all their salespeople, all the logistics people talking up like what 2025 is going to be
Hmm.
or like. And I think there'll be a lot of communication from Informa as we get closer to this show to talk about 2025, because I think legitimately some people are going to be a little bit concerned. Like if I was an exhibitor, I'd be like, okay, well, what is going to change? Like, are all the points going to go away that I've built up over the years? Are there going to be even more restrictions on the exhibit hall floor for me
Yeah,
next year? Like
it's good
all
questions.
all these kinds of things. So I think if I was Informa, and given the fact that they've been so successful with other shows, I just expect to see a deluge of communication and signage at the show in 2024 around what they're going to do next year. So, but yeah, I think most of the changes, as you just mentioned, is probably not going to happen until the following year.
Yeah, someone raised an interesting question. Will Informa take it, out of the current cycle of Vegas, Orlando, and Chicago if they're not too angry? Like, my answer is, well, that prediction would assume that it gets smaller, because if it gets bigger, which is what Informa is likely to push, what other choices are there? I
Right.
don't think there are. So.
No, short of running it in multiple places, right? Like, where you could do like kind of like the LA one where it's spread out over like 16 different venues,
Yeah,
right?
could they do it twice a year and kind of split it? That would be interesting.
Yeah, those would be kind of fun. And I think Informa, that's all on the table for them, right? I think they would look at all of that and say, hey, we should do a fall and a spring, right? And then we can go to New Orleans again, and we can go to Denver again, right? Because would be a smaller event, but now twice a year.
Yeah, I mean, and lots of events do that. They do the, East and West or whatever, and to drive that. So I mean, man, that would be a brave decision, I think. But it would be really interesting and would open up a lot of other venues. I mean, who wouldn't want another HIMSS in San Diego, right? It's such
Oh
a
yeah,
great venue.
it is. Hey, if you're just tuning in, you're listening to Healthcare IT Today with John Lynn and Colin Hung. Today, we're talking about the HIMSS conference news and other hot headlines from this past week. Today's episode is brought to you by Sway Health, our sister publication that's focused on news and stories from the world of healthcare marketing and patient experience. Head on over to Sway, that's Sway with 2 A's, .health, and check out the videos, podcasts, and articles that are there. So, John, moving on from the HIMSS news, on a recent Healthcare Unfiltered podcast, the American Board of Internal Medicine, ABIM, had some pretty controversial or provocative comments that were made on that particular podcast around whether or not doctors should have hobbies that they work on, and whether ongoing certifications by associations are actually that effective in ensuring quality. What's your take on that story?
So my first take is that social media kind of ran with the provocative comment and twisted it a bit, which is no surprise. I mean, that's what social media does. If there was actual news people that covered this, they would have run with it this way too. But his comment when he if you listen to the entire podcast, did get twisted, because everyone twisted and said, well, doctors shouldn't have hobbies, and doctors are obviously kicking back and saying, I'm a runner and I'm still a great doctor, right? Or, I play tennis and I'm still a great doctor, which obviously I think we all understand it can be true. But the way he phrased the comment was actually that, in order to ensure that people are staying abreast of what was needed, that's why they needed ongoing certifications. And his comment essentially alluded to, some people are so focused on their hobbies and spend so much time on their hobbies that they're not staying up to date on what's needed to, maintain a level of understanding for your board certification and for your understanding of the board. So, yeah, like I said, I think they twisted it a little. He didn't say doctors shouldn't have hobbies, which, obviously would be salacious, and he wouldn't say that. He knows that's not true, right? But what's interesting is he is right. I mean, I remember working with a doctor who all he did was look at travel blogs, and he had travel buddies, and he'd plan his trips, and he never did his notes. He had hundreds of notes sitting there waiting to be done, and he'd be off just looking up trips and what his next trip would be. So, like, this stuff does happen, right? Like, where your hobbies, your interests distract you, because of course that's more fun than staying up to breast, on the latest drug that came out. So his concern is a reasonable one, but then the discussion of, are the ways that these associations and these boards, ensuring certification, they have an MOC that they do, that they talked about on the podcast. Is that the best way to ensure that people are staying up to date with the best knowledge? And I think that's actually more interesting, the debate, than can doctors have hobbies?
Yeah, no, I agree with you. I mean, after you explained, the story to me, you could tell that social media had kind of glammed on to that one little comment and kind of twisted it a little bit. I thankfully have not had the same experience where there was a doc who was more focused on their hobbies than on keeping abreast of things. But I have to say, as a patient, I probably wouldn't have known the difference. Like, I really don't know if a doc is keeping up with the latest news or not. Mostly because I think in today's world, if you're that involved in your care, you're probably bringing it up to the doc anyway. Like to say, hey, listen, I saw this study, will this apply to me? I heard about this drug on TV, does it work for me? Right? Like, I think docs in that sense are kind of forced to keep up to date because their patients are getting much more informed. So I'm not sure it's fair, I guess, to your point. I'm not sure it's fair to say that they can't have hobbies and then they should be 100% focused on just keeping up to date on the latest news and happenings in their field. I just think naturally, through what happens day to day in their practices and in their work, they're probably keeping up already.
Yeah.
But you're right. What was more interesting was the comments around whether or not certification is an effective way to ensure that docs are up to the level that their associations believe they should be. And I think one of the comments that was made by the guest was that it's actually not very effective.
Yeah. Well, and what's interesting about that is, like, hobbies do make doctors better, I think. Like, it's the same for employees, right? Having some hobbies, actually distracts your mind and frees your mind to be able to focus when you're at the job, right? So I actually think that discussion is pretty clear, and we've seen that in other employment studies, right? That hobbies are good. It's good for you to get out of the office and not work 15-hour days, right? Like, it actually freshens your mind and lets you be more creative and more thoughtful, etc. So, but to your point, that's so fascinating to think about. Like, patients, of course, have no way to know this, but why would we expect patients to know it when the boards don't even know? Right.
Right.
And I think that was the point of the guy on the podcast. He's like, can you show me any data that proves that people that pass your MOCs or that your other ongoing CEUs or whatever it is that, these boards do, can you show me that that actually shows that those people understand and are good doctors or better doctors? And that was his point, is like, there aren't any studies. We haven't done the studies. We don't know that these things are more effective. It's just theories. And his theory was that's just a way for you to make more money, right? It's not actually a way to ensure that, but you use this overtone like, yeah, well, this is going to help ensure this, as a way for you to make money, even though we have no studies that prove it. And so that was the argument, right? It's like, and I've had this question, a few times, like, how do you measure the quality of a doctor? I don't think anyone has done that in any association or any board or any of those ones, because it's really hard to do.
No, you're right. And, your comments are valid. And I would add one more thing to it. As a former professional engineer,
Uh-huh.
we had the same thing here, where in order to keep my license, I had to, make sure that I, passed a test every so often, or that I, did so many X number of hours of learning, right? But I can tell you, like, in the last few years of me keeping that license, I'm not a practicing engineer by any stretch. And so I would not put myself in the category of a good engineer. And yet I was licensed, right?
Yeah.
Now they've changed the rules to make it a little bit better, but part of the reason, and it was interesting because this came through some of the hearings that happened around this. Part of the reason why there is this testing is to reassure the public that it's a little bit of a PR move to say, okay, well, because engineers are trusted with building buildings and building cars and those, we have to have at least a little bit of reassurance to the public these people are, up to speed on the latest technologies and latest, and in my opinion, I think market forces are much more powerful. Like, if you don't keep up with the latest technologies, the latest techniques, you're just
No
not going to
one's
be
gonna hire
employed.
you.
Yeah, exactly. No one's going to hire you. But it is sort of a little bit of PR. And I could see that. Like, I could see that, hey, I'm a board certified X. I mean, that means something. And as without intimate knowledge of the field, I would go, oh, well, thank goodness someone is looking over this.
See, and I think the guy on the podcast would have argued, yeah, well, you're doing PR, you're not insuring what you should be insuring, right? It's so we're paying you to do PR for us, right? Like,
True.
do doctors need that, right? I don't know if that's true.
It's an interesting one for sure. Let's get to the last one, John. Some headlines that have crossed my desk, certainly, and I've seen more and more of these every day, and that is the lack of M&A happening in the healthcare IT side, and lack of investment, like just a drop off of investment in this space. What do you make of those headlines?
I think this is kind of a repositioning, right? It's a resetting of the market. It had gotten so overblown, and it was so hot that the valuations that happened made it so that it wasn't reasonable. And that impacts both of these, right? It impacts the M&A because the valuations and the fundings that created those valuations made it so that they couldn't be acquired. So now you have to let them run their course, where they either become unicorns and then they do create that value and live up to the valuation that was created, or they become disasters. And then the companies that have cash can come in and sweep them up at, bottom barrel bargain prices, right? Because the valuation was so screwed up. So you have to let that time play out for the M&A to make sense, either with the growth or with the failure, that then they just, okay, they're writing off the investment, and then they'll sweep in and say, okay, well, we'll buy it for less than the the investment. So you have to let that play out. And then on the other end, the investment side, it got so overblown with the valuations that now all this venture capital money is sitting back and saying, we need the market to reset and come back down so that people have reasonable expectations of what valuation should be. So I think that's what we're seeing. We're still seeing investments, right? I mean, they still need to spend money, and when they see a good opportunity, it's still happening, but they're waiting for the reset, I think.
Yeah, I'm not surprised at these headlines, right? Just given the general economy where we are and the situation we are, it's not surprising that we're pulling back on, VCs and investors are pulling back on their dollars flowing outwards. Not surprised that M&A is declining right now, because if I was going to be an acquirer, the longer I wait, the better price I get, right? Like
Yeah.
it's sort of in that
I can
declining
buy the
market.
same thing in a year for half price. Yeah.
Exactly. So I'm not surprised that these are happening, because valuations are coming down. And I agree with you. I think valuations in general were, super inflated over the last few years, especially in healthcare as we came through the pandemic, right? Because there was instantaneous demand for certain things. And if you weren't that familiar with the market, you might have assumed that level of demand would be sustainable. And it turns out it wasn't, for a number of reasons, not just because when COVID was over, we reverted back to our old practices, but also because no one could have predicted that easily the huge jump in operating costs, right, for nurses and clinicians that have suddenly happened. And now hospitals just aren't spending money like they were even before, even though their volumes are maybe back. But I have to wonder, has VC money learned their lesson, in the sense that healthcare returns are not measured in 1 or 2 years. Like healthcare returns take like 5 to 10 years to come back. And do they have the appetite for that? So I'm wondering whether or not the investment level is going to come back anywhere near what it was before, because maybe people finally have realized, this company has still got some good things going on, but man, I got to keep pumping money into them for like 5 years before they get to revenue generation.
Yeah, it feels like there's a Netflix special in there with some of the overpriced valuations that happened during COVID. You think of telehealth and the way it exploded, and that they didn't understand that it was going to drop. Like it feels like there's stories there just waiting to be told. But I'm with you. I don't think we do go back to those levels. That there was a certain vibrancy that was happening that I don't see happening again. The exception might be AI. Like, let's see what happens with AI. Could I see another, spike in investment because of AI? But the more I look at it, the more I think the big players are going to be the winners in AI. And so, I don't think we will see that VC, spike in investment in AI the same way that we did with some other things, because I think it's going to be the big players that are going to be the real big winners with AI. Sure, there's going to be a bunch of small companies that leverage the big players, but these are going to be, $100 million companies, not billion-dollar companies.
Well, I mean, I think for the sake of all of the folks who listen to this kind of episodes, I hope that it comes back. And I think they're hoping it comes back.
More money.
and I think it will. I just think, given what you just said, it will be in more specific areas, maybe like AI. And I also think that there'll be smarter money coming in. I think that the money that will be invested will be tolerant of the longer return timelines, right? There won't be, hopefully, as much pressure to produce a return in 18 months, right? Like in healthcare, because that is a little unrealistic.
Yeah, no one's done it. You need a decade.
There you go. Hey, thanks to all of you who tuned into this episode of Healthcare IT Today. You can find more details about our show by checking out the programs page on healthcarenowradio.com. And please share your voice and engage with the community at healthcareittoday.com and on social media using the hashtag HITSM. I'm Colin Hung, along with my friend and health IT collaborator, John Lynn. Thanks for listening, and have a great week.